and I'll let Dr. Bergie invite our guests this week.
Yeah, so I think probably the issue that the public cares most about is the subsidy prices that we are dealing with. And fortunately, there has been some good news on that front over the last couple of years. We've started to see some of the stats improve. I think though a lot of the work and a lot of the good work happening across the community is still pretty visible. So one of the things that community drug strategies tried to do this year is to really try to be more public and transparent about what is going on. And that includes this call to action, being really explicit about the parties for this year. And it's going to be followed up at the end of the year by a report card really showing, hopefully, that we've achieved what we put forward in our call to action. And so I want to invite a couple of our staff members who support the community drug strategy. We have Josh Video, who's the manager of the team who does that, and Brittany Pagnaco, who's a public health nurse supporting that team as well. And they'll talk to you about the calls to action, which just went up last week.
Thank you, Dr. Bergie. So before I start, I know today's presentation will start the recording. So let's take it over.
Perfect. Thank you all for having us here today.
My name is Brittany Pagnaco. I'm one of the public health nurses on the comprehensive health promotion team.
As Dr. Bergie mentioned, my name is Josh Vega. I am the program manager for the comprehensive health promotion team. So we are excited to introduce the call to action and 2026 priorities for the Greater Sudbury Community Drug Strategy, also known as the CDS. This strategy is a collective effort shaped by dedication of community partners across Greater Sudbury and our district offices. While today's presentation highlights public health's role, our shared success really depends on the continued action at the community level. So each of our district offices also work collaboratively with their local partners on community-specific drug strategies, reflecting the unique needs of those communities. So at its core, the CDS is a community-driven response to a complex and evolving crisis. Grounded in lived and living experience, Indigenous voices, and cross-sector collaboration, the CDS continues to evolve to meet the community needs. Public health is a supportive systems level, bringing together partners, strengthening coordination, and advancing long-term prevention and systems change. Key milestones include the launch of the Take Home Naloxone program in 2018, the opioid poisoning response plan in 2019, and the supervised consumption and treatment services through the SPOT in 2022. Building on the 2023 Greater Summit on Toxic Drugs, the Youth Initiative and 2025 Action Plan have further strengthened this work. As the crisis grows more complex, the strategy continues to adapt, centering community voices, addressing structural conditions, and strengthening partnerships to support a healthier, more resilient Greater Sudbury. So this slide illustrates the significant sustained rise in drug poisoning deaths across Sudbury and districts. That's increased from 17 in 2016 to 114 in 2020. That represents a 571% increase in 4 years. While numbers have stabilized somewhat since then, preliminary data for 2024 indicate 105 deaths, demonstrating that the crisis remains severe and ongoing. Deaths also increasingly involve multiple substances. These trends highlight the continued urgency of coordinated, evidence-informed, and community-wide action through the CDS. This slide shows the suspected drug-related mortality rates across public health units in Ontario and highlights significant regional disparities. Sudbury District, shown in red, ranks third highest in the province for suspected drug poisoning mortality, with rates consistently 2 to 3 times the provincial average. Notably, 6 of the 10 most impacted regions are in Northern Ontario, underscoring the disproportionate impact in northern and rural communities. While this data is preliminary, the pattern is clear and persistent, reinforcing the seriousness of the crisis locally and regionally. These local trends highlight why sustained, coordinated action through the CDS is essential, and why our 2026 priorities are critical to preventing and reducing substance-related harms in Greater Sudbury. We will now provide an overview of the priorities and actions driving this week.
For today, the CDS is putting forward a clear and collective call to action. This reflects what we continue to see in the community, the ongoing harms related to substance use, the gaps in access to support, and the need for stronger community-wide coordination. Over the past several weeks, the CDS has begun the public rollout of the call to action, including the distribution of the position statement on May 1st, and as well as the distribution of the call to action and 2026 priorities on May 12th. Today's presentation is the next step in that rollout, bringing this presentation forward to the Board of Health to support leadership and support accountability. The community drug strategy belongs to all of us. Everyone has a role to play in supporting a healthier and safer Greater Sudbury. Together, our community can advance health equity and ensure everyone has access to safe and accessible services. The CDS welcomes continued collaboration and encourages community members to engage and share their voices to help move this work forward. The 2026 part of the community drug strategy addressed key needs identified by partners and by community members, ensuring that services are more coordinated, that supports are easy to access, and that we are better positioned to respond to the emerging trends of substance-related harms. Importantly, these priorities are informed by evidence and by the voices and experience of community members. This helps ensure that our efforts lead to outcomes that are relevant, grounded in real-world experience, and that it is responsive to what matters most for the residents in Greater Sudbury. Often in our community, people seeking help with substance use are unable to easily access it. It is a complex and fragmented system that is difficult to navigate. And as a result, too many people are left without the support they need, especially after critical moments, when support is most needed. This priority focuses on improving coordinated care for all substance use needs. The CDS envisions a fully coordinated, inclusive, and equitable substance use system for Greater Sudbury. This means ensuring that people can move smoothly through the system no matter where they enter it and receive consistent, connected support. A system where every person can easily access the support they need and that services across the city work together, making navigation and referral pathways simple and clear. The CS will move towards this priority by first creating a standardized referral and follow-up pathway to ensure people don't fall through the cracks after critical touch points, such as after hospital visits, incarceration, or poisoning events in the community. The goal is to make sure follow-up happens at all stages and that people are linked to the right supports at the right time. Second, the CS will strengthen treatment pathways and timely access. This activity will focus on ensuring people can access treatment when they need it across the full continuum of substance use care. The goal is to reduce system-level barriers and wait times by aligning partners and strengthening coordination. Third, the CS is working to expand harm reduction and outreach to improve access to evidence-based supports. This helps reduce barriers, it strengthens early intervention, increases safety, and better connects people to treatment. Together, these actions lay the foundation for a substance use care system that is coordinated, inclusive, and equitable. Prevention efforts are not reaching people early enough or in ways that reflect their realities. Structural stigma, racism, and inequities continue to shape access, and the voices of Indigenous communities and people with lived and living experience are not always centered. As a result, this priority focuses on preventing harm and supporting well-being across the lifespan. The CDS envisions a system that dismantles structural stigma, embeds Indigenous-led and culturally safe approaches, and meaningfully engages with people with lived and living experience and priority populations in decision-making. The TDS will move towards this priority by, first, having people with lived and living experience and Indigenous people in leadership and decision-making roles and acting on their recommendations. This includes the new introduction of the Indigenous Advisory Committee, and as well as the new introduction of the People with Lived and Living Experience Advisory Committee. This means sharing power and valuing expertise. This activity reinforces our broader commitment to continued community engagement through participation across various structures throughout the strategy. Secondly, the CDS will use a stigma assessment tool to measure stigma and how it's showing up in sectors such as health, justice, social services, and extractive industries. This will help to identify how and where stigma is showing up in those organizations. After the assessment, organizations will make changes to policies or practices that are causing stigma within the community. This will help to build a shared understanding and reduce discriminatory practices throughout the community. Lastly, the CDS will use strong evidence to drive prevention. We will apply evidence linking how stigma, racism, poverty, and belonging increase the risk for substance use. We will focus on early intervention and system-level barriers, system-level changes that address root causes across the lifespan. So why does this matter now? The severity of the toxic drug crisis highlights that stigma is a major barrier to care. Stigma limits access, it undermines trust, and it contributes to preventable harm. Addressing it requires coordinated action across all systems. Overall, this priority recognizes that prevention is powerful. Investing early through an equity lens, it strengthens belonging and it eases pressure on our acute emergency justice and social systems. Many people in our community face barriers to accessing stable housing and basic needs services due to services that are uncoordinated and hard to navigate. As a result, this contributes to poor health and increased substance use harms. This priority focuses on strengthening how housing and basic needs services are planned, coordinated, and delivered throughout the community. The CDS envisions a community where housing and basic needs services are easy to navigate, well coordinated, and responsive to people's needs, especially those facing the greatest barriers. This will be achieved through clear, connected service pathways across housing, health, and social services, where people can access timely, consistent background supports in safe and welcoming environments. The CDS will move towards this priority by, first, creating a map of physical pathways and service connections, building on and enhancing the existing City of Greater Sudbury service gap analysis. This activity focuses on how people access housing and basic needs services within the broader system, mapping pathways and identifying gaps across services. This activity will support the identification of specific actionable gaps to remove barriers. Secondly, the CDS will review the current basic needs landscape to inform high-impact interventions to strengthen how systems support people's basic needs. This work focuses on the key social determinants of health that can directly influence substance use outcomes. By addressing known barriers, we aim to improve and ensure basic needs supports are connected, responsive, and effective. Overall, strengthening housing and basic needs services is a concrete action to reduce inequities, improve health outcomes, and ensure that our system works for everyone. Substance use is a complex issue. The response to it involves many partners working across various sectors. Because of this, it can be difficult for the public to see the full scope of the work underway, or to recognize the steady progress that is being made across the system. This year, the community drug strategy is introducing an evaluation approach designed to support accountability, track progress, and make work more visible to the public. A key part of this approach is the annual report card, which will be shared with the community and available on the community drug strategy website annually. The report card will clearly communicate what has been accomplished, where challenges remain, and where we are working towards our priorities. Overall, this approach supports transparency, builds confidence, and helps us to learn and adapt and respond to community needs while reducing substance-related harms. Thank you for your time, your leadership, your continued commitment to the health and well-being of our community. Today's call to action reflects what we have heard clearly from community members, Indigenous partners, and people that in living experience. The community drug strategy is not owned by any one sector or organization. It belongs to all of us. Together, we can build a safer, healthier, and more supportive community for everyone. We are happy to take questions.
Thank you both for the presentation and the detailed information. I'll open it up to questions, board members. Any board members have any questions? See, Bob Barkley has his hand up. Go ahead, Bob.
Yeah, thanks very much. That was an excellent presentation. I have one question and one comment. So beyond opioids, what are the main culprits? What drugs are you concerned about?
So thank you for the great question. Beyond opioids, we're focusing on all types of substances. So this includes benzodiazepines, stimulants, alcohol, cannabis. All substances are being included as we move forward with a full stream approach. There's more specific substances per stream. So within prevention, we usually focus on alcohol, cannabis, and then with more of our substance use care stream, it's also around support. It's more focused on the opioid and illicit supply.
Okay, and just the one comment I have is that you know, given that Sudbury, I think Sudbury and district is in the top 3 according to that bar chart that you showed, I suspect that other agencies throughout the province will be looking to us or to you folks for advice on how your strategy is working, right? As we seem to have one of the most compelling problems province-wide. It's just a thought. I'm not sure if that will actually come to fruition, but
maybe a comment on that briefly. I don't think anybody's figured out the magic solution to the substance use crisis really anywhere in the world. And so we're always looking at everybody else to see what they're doing that's succeeding. including our friends over in Europe. And likewise, I think others are going to be looking at us to see if we find anything that has great success. Obviously, if we do find something that is really successful, we'll be sure to be sharing it proactively with all our friends so they can implement it as well and publishing it as well so it's available throughout the world.
Okay, thanks a
Thank you,
lot.
Dr. Vigil. Any other questions, Bob, or that covers your
Oh, that's it.
question?
Thank you.
Thank you. Okay, Mike.
Thank you through Mr. Chair. Thank you for the presentation. For some of us really paying attention to all efforts because I don't think a number of us within the community are satisfied with our performance as a municipality. Despite a number of efforts. I'd like to see that, I think you called it, it wasn't, it was a scorecard, I think you called it. And I guess there'll be KPIs tied within that scorecard, is that correct? Looking forward to learning more about that and how we're doing against KPIs. With respect to something like housing, which is such a big issue within Sudbury, are there early thoughts on opportunities to assist? Because we know one of those root cause issues is lack of affordable housing, lack of places for persons to live. Have there been discussions about how we're going to help within that space when you actually need infrastructure to support?
So I think there's a couple of questions there.
Yeah,
One on
sorry.
APIs. So I'm just going to take that question. Please go ahead.
As well. So, thank you, Mr. Chair, thank you. So in regards to the report card that we'll be putting out at the end of the year, not only are we looking at immediate outputs, so what are the deliverables by the end of 2026, those being like increased access to care, navigation, as well as increased access to basic services through the support stream. We're also looking at long-term indicators to show those real health impacts within our community, because this actually having longer term impacts on systems as a whole, because this is a systems level approach to the community strategy and access in our community. I'm going to go on to the next question as well.
Yeah, absolutely. Go ahead.
Could you sorry repeat the other part of the question?
Literally about housing.
Housing, yes. So for the background support stream, as I mentioned previously, we work closely with the city of Greater Sudbury to look at what type of housing models we have within our community and what sort of services and supports we are bringing to those different types of housing models to ensure that that is sustainable for those individuals in those housing models. It can't just be we provide someone a house, it has to be how we provide the background supports with that house to ensure that they can transition through those various housing models. That being said, if we could, I think it'd be very beneficial from a provincial and federal standpoint to have greater increased transitional housing in our area and have a greater housing stock.
That answer your question. Thank you.
I have
follow
One last question. Thank you, through Mr. Chair. Again, within the drug strategy, there are a number of members of the community that are probably looking for help, and there's just limited options for them. So this is trying to fill some of that gap. But what have I experienced? There are also some members within that community that are not looking for help, or are not necessarily ready or on the journey to looking to get off drugs or move off the street even. How is the drug strategy? Are there components of drug strategy to assist those that are really, I'll use the word refusing to,
Yes.
Thank you. So the community drug strategy takes a comprehensive approach to substance use. What we've seen recently is, I would say, even disagreement between it being, do we take a harm reduction, do we take a treatment approach? The approaches are complementary in nature. So in order to have a comprehensive approach to substance use, when you look at something like our substance use care stream, which is looking at healthcare pathways through the community, we're taking a comprehensive approach to those pathways. So providing harm reduction supports for those that might not be seeking recovery yet, as well as providing various treatment approaches and looking at models such as step up, step down, rate. So those might enter into a different model, so might enter into a treatment service, but not be ready for it. They can transition back to another civil of care, so they're not really using the service of care.
So sure, if I can maybe just add on to that, I think every single person who's suffering from substance use addictions wants to get better. I don't think anybody thinks that this is a great way of living. People in this situation are suffering. I think it's really important to be mindful that there's probably things that are preventing them from getting down to the point where they are ready to start to seek care. In some cases, it's they don't know where to start. In some cases, it could be that when they have tried to access support and services, they feel really stigmatized, they feel not welcome there. And so they turn away and go back to a place where they maybe feel a bit safer, even though they know it's not the best for them. I think in some cases it's that people, start on the journey of getting care, and then they find that the bottom falls out of them because we have so many gaps between our services, and you move from one service to the other, and things fall apart. And so those are some of the things that we're trying to address here, really making sure that when people start to reach out for care, it is an open, accessible opportunity for them. They feel welcome and supported to join that. That when they start to receive care, that it's not receiving just the one little piece, it's really looking at the whole person and the entire wraparound to make sure they feel well supported. And I think if we do that, we're going to see pretty much every single person who starts on the journey to care is going to stay on that journey and actually complete it, as opposed to people who I think sometimes feel that they don't feel the support is out there for them, or that seeking support maybe feels so harmful to them they don't even want to try.
Does that answer your questions? Any other questions or comments from any other board members or presenters? Just have a question related to, so like Mike indicated, so talk about transitional housing wraparound services. Talked about aligning, have conversations with the city and working together collaboratively. I just want to sort of change the narrative because I appreciate the scorecard. I appreciate that coming out, because I think as a municipality, in conjunction with public health and other agencies, we are moving that needle. And we hear in the public format, it's always city's not doing enough, public health not doing enough. We are making strides, so I look forward to seeing that scorecard, because I think it would hopefully take away some of the myths that we're just standing by and it just keeps growing and we're not addressing those concerns. So I just want to commend you for bringing this forward, and look forward to that report. The question I do have is, we talk about, like, there's GSPS involved, so Greater Sudbury Police Services, there's public health, there's the city. How does HSN help her in this role? Because we see that a lot of situations, there's issues with vulnerable, they get brought to HSN, they get treated. It's just sort of like a rinse and repeat. So how is that being addressed? So I'm not sure who wants to answer that question.
Want me to start, or? Okay, so HSN is a key partner in this. David Meal, the CEO of HSN, sits on our executive committee. He's also actually taken on leading the stream group that is actually working on those referral pathways and figuring out what are the gaps in treatment to make sure that we bridge those. So I would say HSN is very engaged and involved, and they really are trying to do their part to make sure that they address what's happening on the treatment side.
Perfect. So just keep up the great work, and looking forward to this scorecard, because again, and I'll repeat myself, it's a message that's getting out in the media. I call it the fake news. Unintended, it's not media putting it out there, it's just social media itself. So it's showing that to the community that we're actually addressing it, and we're not just putting our hands up and saying we can't do anything about it. So thank you both for your presentation.